Uganda's annual HIV/AIDS expenditure stands at 1.2 trillion shillings, with donors contributing 67% of the funds, while government meets the rest. Although the government has in this financial year increased the HIV and AIDS budget to 168 billion shillings, donor contribution has remained stagnant over the years, yet the country's HIV prevalence rate is rising at 7.3%. According to the statistics from the Uganda AIDS Commission, out of the 600,000 HIV/AIDS patients in need of the antiretroviral drugs, only about 300,000 people have access to the treatment, an issue that has prompted government to cry out loud to the donors.
The biggest challenge that will continue to face this is insufficient resources to buy these drugs and sustain the levels of funding required. I therefore wish to request the international community, your partners, friends in this house and elsewhere, to sustain and, if possible, increase the financial resource.
The funds on request will supplement the 100 billion shillings the government earmarked for ARVs in this year's budget. But how safe is Uganda if most of its HIV budget runs on donor support?
As a country, definitely we are not safe relying on donor funding, because you can never know when the donor will plan to withdraw. If they are to withdraw, it will be in a phased manner, and they will give us time, to put in mechanisms to mitigate the effects of their withdrawal.
Different ideas have already been floated on how the country can look for funds to supplement the already constrained budget, including establishment of an HIV/AIDS trust fund.
Through this fund, we think we can mobilize as much as $350 million annually.
The proposal, which is already submitted to Parliament, was a leaf board from neighboring Kenya and Tanzania, where a percentage of taxes proposed to be imposed on commodities and the money remitted to the fund.
What is the problem of charging 10 shillings for each bottle of alcohol sold? This is a simpler way of raising the resources if they can be managed properly.
As government rushes into an emergency plan of self-sustenance, medical experts are calling on prevention of new infections as the best strategic plan.
And so we have to go back and start communicating with the people and telling them HIV is still dangerous.
Solomon Serwanja, NTV.